everyone. I'm Dr. Susan Blum, the founder and director of Blum Center for Health, and I'm so excited to welcome you here with me in this moment to introduce you to Dr. Irina Weil, our newest member of our team here at Blum Center. Welcome, Dr. Weil.
Thank you, Dr. Blum, for the introduction.
You're very welcome. And so as part of our way of, I was really looking in the sort of our reason for bringing this video to you who's listening and watching is because I really feel that I'm excited to share Dr. Weil with you, and I want everyone to have a chance to meet you and to learn a little bit about you and your interests and your approach to medicine and really to, I want everyone to get as excited as I am that you're here. And so that's really our goal for our little brief video today. So I was thinking maybe as we get started, maybe you can start out by just telling everybody why you love functional medicine.
Sure. So I feel like in functional medicine, we are little detectives trying to get down to the why of the person's symptoms. Why are they presenting the way they are? And I think what functional and integrative medicine does really well is not only explore the organic physiological processes that may be going on that may be contributing to the patient's symptomatology, but also looking into their environment, not just what they put in their body, but what they put on their body, their living environment, their home work environment, as well as their hobbies, what they like to do in their free time, such as hiking. And those give us little clues of potential exposures that may be contributing to the person not feeling well.
Okay. Yes, environmental medicine. Oh my goodness, that's a passion for all of us, right? And I know that's a very big passion for you. And you know, when we're detectives, as you said, and that's one of the things about functional medicine that I love also. It sort of gets my juices going, right? To really have a problem to solve and to try to figure out what the underlying cause of this person's issues or symptoms are. And that's one of the reasons I love functional medicine too. And we have all these great places we go, right? To sort of, to identify the things we look for. And a lot of them are in the environment. And I know environmental medicine, looking at these environmental triggers are a big passion for you, right? And you have a lot of experience with that. Can you say a little bit about mold and ticks and Lyme disease, and just anything you want to share about that?
Sure. So mold and Lyme may come out as indirect presentation to why a person may be coming in. Some people present with autoimmunity, and we've ruled out the gut as a potential cause. Now we have to explore their toxin load and other potential infectious agents that trigger their body's reaction to reacting to self. So that's one avenue. Another avenue is people present with very unusual neurological symptoms, or very
like what? Like what? I mean, like numbness and tingling in their hands and feet, or
numbness, tingling in their hands, or things migrating in their body, pain that doesn't make sense. They go to their doctor, and the doctor does a whole battery of tests, or they have their $1 million workup, and they're told it's fine, or they're being labeled as fibromyalgia, and the conventional tick-borne panel comes back negative, but yet they have this history of tick exposure, or maybe even having Lyme disease in the past that puts them at risk. So we have to dig deeper. We have to do other testing, other specialty testing that will give us the answer.
Right, you and I have talked about this a lot, and you and me and all of us here, we have to think about it, right?
Yes.
The problem is you go to your conventional doctor, they don't even do Lyme testing. They don't even think about it. And that is something we think about all the time, right?
Yes, it's actually part of any new patient that comes in. I always screen for Lyme disease as part of the initial lab work.
Right. I mean, we're here in New York, so how can you not?
Yes.
Right. And so that's definitely us. And the same thing with mold, right? It's something that in the conventional world, nobody talks about mold as a causative agent or as an underlying trigger for potentially the inflammation or the health issues that somebody's having.
Yes, that is correct. And mold is very tricky. There's really no good conventional test. And in the integrated world, the testing is so and so and can be costly. So I really take a focused history, especially their living history and their work history and their childhood history. And then if need be, use the patient's resources to focus on where they spend the most of their time to investigate where the mold potential exposure is coming from and address that first rather than necessarily, oh, do they have mold or not? Because based on the presentation, if my clinical suspicion is high enough, I'm going to say you have mold. Let's figure out how to remove your exposure first.
Right. And removing the exposure first is always the first step. You
Yes.
can't even treat anybody. Even if we needed to move into more advanced treatments, which we can do, and I know you know how to do as well. We always start with remediation, helping them figure out how to get rid of it in their environment. And I agree. And I think that, it's like the lost art of medicine, right? Taking a really, really, really good history and using our clinical sort of judgment to try to figure out what's going on. And that's why we spend, right, 90 minutes with a new patient.
Yes.
Right? So that we really can drop into that part of us that can really figure out where to go or where to start or what we think is going on without even running any tests, right?
That's correct.
Yeah. So environment is a huge thing. And of course we do toxins. So functional medicine, right? Why we love it. So this detective work. So we're doing toxins and we're looking at, of course, the lifestyle piece, everybody knows that functional and lifestyle medicine sort of go together. So we do food and we do sleep and we do stress and you're great at all that. And I know. I wanted to steer the conversation though. I mean, you can comment on that if you want, but I wanted to talk about the gut next, because
Yes,
that's the other really big, foundation of where we're looking for a possible sort of, I call it the tack that somebody's sitting on, right? Like looking for those triggers.
Yes. I always tell myself, when in doubt, start with the gut.
Yes.
So when there's a lot of things going on and the person just feels really horrible, a lot of the times there's inflammation coming from the gut. And even before I finished medical school, my biggest learning experience actually came from my husband, and we met while I was in medical school. And through me dating him, I discovered he has a history of long-term gut issues. And through us dating, he decided to experiment with food per my suggestion, and we discovered he has intolerances to gluten and dairy. He does not have celiac, but he cannot tolerate certain kinds of gluten. And so
what happens to him
that,
when he eats it?
Bloating.
Yeah.
Bloating, stomach pain, just uncomfortable feeling. And so because of that, he has modified his lifestyle and is able now knows what he can and can't eat. So it was as simple as that. But I know people that come in to see us, it's a bit more nuanced. And a lot of times people have already tried the food plan. So we need to take one step further to explore what is exactly in their gut microbiome, to look at the bugs, to investigate if they have small intestinal bacterial overgrowth, to treat them with herbs and other anti-inflammatory supplements.
Yeah. So it sounds like that. Isn't that great? Like we get these learnings from working with the people around us first, right? So your
Yes.
husband, I of course did a lot of work on myself, which I've written about in my books, which everybody probably knows about already. But really, it gives us the opportunity in our own evolution as physicians to have those aha moments where you really see the power of food. And I think that is one of those things that sets us apart from a conventional gastroenterologist, for example. And to this day, my patients will come in and say, I just saw my gastroenterologist. They told me I could eat whatever I want. They don't think food has anything to do with it, right? You're laughing, but isn't it true? Like,
it's crazy.
Isn't it hard to believe that there are still doctors out there that think that food has nothing to do with what somebody's, sort of showing up with in their office?
It's wild because we know all about the gut-brain connection, and we know
and the food-gut brain
and the food gut, and we know a lot more travels from the gut to the brain than vice versa.
Yeah. And the influence, I know, and the influence of food on the microbiome, right? So food you change your diet, the bugs change, right?
That's correct.
So yeah, so I think that that from the why do we love functional medicine and what do we love to do, right? healing the gut is so, I call it ground zero, for us, but it's ground zero now. I think, I've been doing that for 20 years, and it's just such a core foundation for functional medicine. But isn't it so interesting that it's now become mainstream, right?
Yes.
So on the magazine covers and everywhere, you can see the conversation about the microbes, and we're learning more and more every day. And so, so certainly, excuse me, certainly that's something that you do, that that you're good at, you have experience with. Repairing the gut is so central to everything that we do, right? And I know you
Correct.
love doing that. And so as we wrap up our time together, I just wanted to ask you, Dr. Weil, is there anything else that you're interested in, any other passion that you have in medicine, or people you love to work with in your practice?
Yes, I love to work with women, especially women struggling with postmenopause. From my time in the conventional world and conventional training, I always sense the frustration and just upset with the system of them not being able to find relief with their fatigue, with their weight gain, mood instability, and even osteoporosis post-menopause. So that's been a big passion of mine. And at the Blum Center, we do specialty testing. One of them is called the Dutch test, to really assess how a woman processes her estrogen. And it's a urine test, and that tells us the types of estrogens that they're metabolizing, and also what the long-term effect, especially on their cancer risk, is. And from that, we're able to come up with a supplement program to help either up regulate those estrogens or down regulate those estrogens. And then as well as using some bioidentical hormone therapy to treat some of the postmenopausal symptoms and potential bone loss that women experience after menopause.
Oh my goodness, there's a whole bunch of things to unpack in there. And so, yes, we love we see a lot of women who want us to support them with their symptoms of north of 50, right? Or, menopause symptoms. Really, the other thing about so I just want to I will add to what you said, that one of the other things I love about the Dutch test is that it also looks at the adrenals. And the adrenals are such an important piece, and this, such an important piece to, understanding why a woman has persistent symptoms, right? Because coming into menopause with so much stress and depletion and low resiliency from the 40s, sometimes are a really rough decade for a lot of women. And so that's the nice thing about the test that we use, to really look at sort of the endocrine orchestra, which includes the adrenals, right? And it includes all those downstream metabolites of estrogen, which is so important that you talked about. And I really, I just, over the years, we have both helped so many people, so many women through this transition. It's really a transition. These symptoms, it's common to have some of these symptoms, but they shouldn't go on and on forever. So, we're here to help with that. You mentioned bioidentical hormones. What's your approach using bioidentical hormones? Do you give them to everyone? Do you, how do you feel? Let's start out with, what are bioidentical hormones, and how are they different from Premarin and the common prescriptions that women often get from their gynecologist?
Sure. So first of all, not everyone would get bioidentical hormones. It involves taking a very thorough history, and there are certain situations where they're contraindicated, such as certain family history or personal history of cancers, and or smoking, migraine, headaches. So we really have to weigh the benefits and the cons of prescribing such therapy. That's number one. Number two, the conventional hormones are synthetic, versus the bioidentical are more in line with the physiology of our own body, what our body produces. And we get them through the compounding pharmacy, and they're able to dose it accordingly and really personalize it to each patient.
Right. So we work with the compounding pharmacy to adjust the dose. And that's the other thing that I find. So even if you did bioidentical estradiol, for example, which you can get from the regular pharmacy, they have these patches, the Bival dot some women use. The problem is you only can get one dose. It comes in one dose, and it's in this really sort of gross, sticky sort of patch with sort of chemicals in it. But you can't adjust the dose and get it really personalized with women. So that's the other reason that I also do like, and most women do need that. for sure. And, you know, it's interesting with bioidentical hormones, and I know you know, we've talked about this, is that, you know, I think that, like, I prescribe them as well. But in general, I believe menopause is a natural state. I don't believe it's like a disease, you know, like there are some gynecologists and there are some doctors out there that believe menopause is sort of a hormone deficiency disease and that every woman after menopause should have hormones. And so my goal usually is to help women transition through menopause with all the other ways we know how, and using herbs and supporting their sleep. Actually, you know, and I'll stop and I'll let you speak a little bit more to this, but but you know, I think it is really, really important for us to make sure that we have tools and we can offer hormones to women who need it or who want it. Some women just know they want it. That's it. And so we need to do it safely. And so I'm really proud of our functional medicine, and that's why you mentioned the Dutch test too and these metabolites, because we know how, what makes us different, right? We know how to prescribe hormones for women in a way that we can do so safely. We don't, and really feel safe. Like we know, like, you know, how to make sure it's the body's handling the hormones in a healthy way and not in a way that can increase their risk for breast cancer, for example. And so, so I think that we're really, that's another great thing that I love about functional medicine. What about you?
Yes, and what I also love about the hormone aspect is on the scale of easy versus hard, it's a relatively easy intervention to make the patient feel good right away. So it's rewarding for both the patient and the practitioner. Everyone feels good about the whole process.
Yes, exactly. And so, and I especially, like I said, love that we know how to do that in a much safer way because we're thinking about all the whole body and the whole person and making sure everything's being brought in balance and in a safe way.
Yes.
Cool. So is there anything else that you want to add before we wrap up and say goodbye to everyone?
That I'm super grateful to join the Blum Center, and I'm very much excited to work with everyone and looking forward to seeing people in my beautiful office.
Okay, great. And actually what I will add as we say goodbye is that even though we just talked about, you know, triggers for autoimmunity and toxicity and ticks and mold and gut health and hormones and adrenals, we see everything, right? And you do too. But these are particular things, so anyone can certainly come in and see you, and as well as me, although I'm not really taking new patients anymore. So I'm especially glad that you're here because I'm really having a great time working with you and helping to grow the center, even, you know, because my capacity is sort of limited at this point. So, so yes, and so I just wanted to say that we see everything, but it's good to know that these are the things you're the most passionate about.
Yes, thank you, Dr.
Okay.
Blum.
You're welcome, and thank you, Dr. Weil.